Hi, I'm Sonya Moore, a CRNA, and I'm the Nurse Anesthesia Program Director at Case Western Reserve University, Francis Payne Bolton School of Nursing in Cleveland, Ohio. And I was asked to tell you guys my story as to how and why I became a CRNA. So when I was a junior in high school, I was a part of a program in East Cleveland, Ohio, that allowed us to shadow healthcare providers. I had chosen to shadow an anesthesiologist. So the next day I went to shadow the anesthesiologist and we had breakfast, and then he took me to be with the CRNA for the rest of the day. And once I left the CRNA, I was totally convinced that that's what I wanted to do. I enjoyed everything about what we had done that day, from the interviewing of the patients to actually giving the anesthesia care. So when I got home, I told my mom that that's what I wanted to do. Neither one of us knew what we needed to do to make that happen. So we did call the AANA, which is the American Association of Nurse Anesthetists, because at that time there was no internet or email. So we called them. They sent us information about all the schools in the area, and we found that there were two schools in our area, the Cleveland Clinic program and the Mount Sinai program. I contacted both of those programs, and Dr. Jack Kless, who was the program director of the Mount Sinai program, called me back, and we had a really long conversation about my experience and what it was to be a CRNA. And well into that conversation, Dr. Kless asked me what nursing school had I attended, and I told him, "Sir, I haven't been to nursing school. I'm only a junior in high school." And he was kind of flabbergasted by the conversation we had just had. And he also offered me advice in terms of which nursing programs to go to. He instructed me to go to a 4-year nursing program, because by the time I had completed a 2-year or an associate degree program, the entry into practice for a CRNA would have been a bachelor's degree. So I proceeded to go to the University of Cincinnati and received my bachelor's degree, and came back, and I worked about 3 years or so in critical care before I actually did go back to nurse anesthesia school. And what I will say is that the foundation in nursing for the CRNA is probably the best thing that we do, because it offered me the aspect of kindness, compassion, and empathy for my patients. And I think it's made me the well-rounded CRNA I am today. So that's why I became a CRNA and why I became a nurse. Happy Year of the Nurse.